Declaring an Omicron emergency, the UK government has announced a speeding up of its COVID-19 booster campaign. It's aiming to offer all over 18s in England a booster shot by the end of this year, starting this week. Omicron cases in the UK are thought to have been doubling every 2 to 3 days.
We're now facing an emergency in our battle with the new variant, Omicron. And we must urgently reinforce our wall of vaccine protection to keep our friends and loved ones safe. Earlier today, the UK's 4 chief medical officers raised the COVID alert level to 4, its second highest level, because of the evidence that Omicron is doubling here in the UK every 2 to 3 days. And we know from bitter experience how these exponential curves develop. No one should be in any doubt. There is a tidal wave of Omicron coming, and I'm afraid it is now clear that 2 doses of vaccine are simply not enough to give the level of protection we all need.
Other parts of the UK, Scotland, Wales and Northern Ireland are also speeding up their vaccination programmes. On Sunday, the UK reported over 1,200 new confirmed cases of the Omicron variant, a 65% rise from Saturday's total. When Britain eased COVID restrictions in June, the alert level for the country was at stage 3, which means the epidemic is in general circulation. The government's experts have now raised that to level 4, which means transmission is high and pressure on healthcare services is widespread and substantial or rising. The UK Health Security Agency says existing vaccines appear less effective in preventing symptomatic infections in people exposed to Omicron, but the preliminary data shows effectiveness appears to rise to between 70 to 75% after a 3rd dose of the vaccine. Experts warn that the Omicron variant could become the dominant strain in the UK by the end of this month. Infection rates have remained stubbornly high in Britain at around 50,000 positive COVID tests per day. In London, Omicron already accounts for around 1/3 of all COVID-19 cases. And for more on Britain's preparation for the booster drive, we can cross to WION correspondent Benji Hire in London. Benji, how quickly does the UK's booster campaign need to accelerate now to hit these new targets?
Well, at an unprecedented rate, if we're talking about sort of UK levels. In the next couple of weeks, the UK health system has to try to vaccinate about 20 million people. My quick maths tells me that's approximately 1 million a day. If you compare that to the averages over the past couple of weeks, the UK has done a fairly good job of vaccinating about 300,000 people a day. At its peak, it was 500,000. But those rates have to be doubled in order to reach those targets. And the government says it's essential to reach those targets because of what you've been saying before in terms of the rapid spread of this virus. Sajid Javid, the Health Secretary, calling it spreading at a phenomenal rate. And so in order to try to get as many doses into as many people's arms as possible, the military has been drafted in and the priority has totally shifted in the NHS. So non-urgent treatments have been put on hold and the attention now fully on that vaccination programme. It's important to note that at this point, only 10 people in England are hospitalised with this new variant, Omicron. And there have been no confirmed deaths, but the government's attention firmly on trying to prevent a bigger outbreak so there aren't further hospitalisations or indeed any deaths in the weeks to come.
And Benji, is the government ruling out needing new COVID lockdowns or school closures because of the Omicron variant?
It's not actually. Health Secretary Sajid Javid in the past few hours noting that whilst he doesn't want to be shutting schools again, something that did happen at certain points of previous lockdowns, it has to remain an option on the table. That's sort of been a government position quite a lot during coronavirus, that nothing is off the table. And the risk of spreading in schools is something that many scientists are worried about, given the fact that school children aged 12 and over, 12 to 15, have only been offered sort of 1 dose of the vaccine. And restrictions, so there's not a full amount of protection there. But the government insists that it's pinning its hopes at the moment, at least, on its plan B, which is implementing more masks inside, work from home guidance, and indeed that booster programme. It's those things that the government wants to see being a success here. The scientists insisting that it is those extra third vaccinations which can help reduce the risk of severe illness. But it's worth noting amongst all of this that we've been here before, that there have been previous instances in the past 2 years where the government has said that it will not be putting in further restrictions, only to then U-turn weeks down the line. And it's something that we've seen on mainland Europe as well, where there are in some countries lockdowns and mandatory vaccinations. Not at that point in the UK yet, but it's something the government is being pressured to do by many scientific bodies.
OK, Benji, thank you. That's Benji Hire reporting from London.